Hi, Dr. Alina Kolchitsky, Boutique Bodyworks, Physical Therapy, Lifestyle Medicine, Fitness, Nutrition, and more. Welcome to this month's collab episode on posture. So what do we know about posture? We always hear now controversial research that sometimes says one thing and then another time says the opposite thing. So what to do? What to do is keep moving. Yes, as you hear me say it in almost everything we do, it is the key to feeling and functioning better. And this is true for posture. So yes, there is conflicting research, and posture is complex. There's a lot of things going on in terms of the inner workings of our body, positionings, and so on. And it can be very individual as well and dependent on our age. So that's why the research is controversial, because it may capture some what is true for a certain age and certain bodies and not other. And so you want to take always research with a grain of salt and make sure you look at those details before you decide to accept or reject. So what I'm going to share with you is just a little bit about that and then get into it. Okay, so what we do know is that being able to change your posture is what leads to having less pain. So staying in one position too long or not being able to adopt a variety of positions is what can lead to pain and dysfunction. So for short periods of time, a posture can load your structures in a way that may be hurtful for some people, and other people may not cause any pain at all, particularly in a younger body versus a body that has gone through some degenerative changes. And this is especially true for the spine. So from the neck to the tailbone, loading the vertebra or the bones, in our spine can be painful if they don't change. If those loads are placed on those bones of your spine for even short periods of time, if there's degenerative changes. Therefore, not sitting for too long, equally not standing for too long, or during waking hours, laying down for too long. So any sustained position means the load is being applied to the tissue in a way that over time starts to hurt. So we need to disperse the forces. How do we disperse and change where the load is happening in your tissue? By moving. Yes, it's pretty common sense, right? So that's why we need to have the ability to change our posture. And to be able to have a variety of postures available to us means exploring them on a regular basis. If we don't move in certain directions over time, we lose the ability to move in those directions. Common sense, right? So that's what it comes down to. We do know that good posture, quote unquote, right, so having ourselves lined up and not slouching or slumping, good posture does affect our mood. Science evidence does seem to be consistent in that regard. So if you do struggle with mood, anxiety, or depression, consider your posture. Do you tend to sit like this most of the day? It's in fact been shown that changing your posture to more upright can immediately lead to feeling more confident and more positive thoughts. So keep that in mind. It affects mood. Also, slumping after a meal can cause heartburn. Why? Because you're compressing your stomach and the acids there, and so they don't have the space to do and mix and so on, and that acid starts to push up as well because of that compressive force, and so that can start to over time weaken the valve, the esophageal valve to the stomach, and so that gets to stomach acid coming out into your esophagus or your tube that takes food from your mouth to your stomach. So after meals, especially if you do have problems with GERD, reflux disease, or indigestion, so to speak, then make sure after meals we do have good posture and don't slump. So indigestion. Also for lung capacity. So if we're, slumped like this, you can imagine that my lungs don't have as much room to expand. So being able to sit more upright and wide so that the lungs have room to both expand this way, and this way, because our lungs are three-dimensional. They don't just, contract and relax in one direction. They do it in multiple directions. So by having good posture, we allow the lungs to do that and therefore give you better vital capacity, the ability to take in oxygen and get rid of carbon dioxide, the waste gas. So that oxygen to the tissues is needing to be delivered with every breath. That affects your tissues over time. So in that regard, lung function and oxygen delivery, good posture is important. And those are the main important things. So that's why we do need good posture. And then with pain, again, it's changing where your load is. So we're going to go through a nice, very quick, easy series of movements that you can do seated. We're going to make sure that you're in a chair that doesn't move, so not these rolly chairs where as you're moving you could slip and fall off, right? So make sure that you're on a stable surface. And yeah, I'm going to include this video in the program so that you can have quick, easy access to it and not have to kind of shuffle through all of the videos in the collab component. So it is going to be there in the collab, but you're also going to find it in your anatomy toolbox, okay? And maybe I'll put it in the program too, like I said. Okay, so let's get to our movements. So get away from your rolly chair if you're not already on a solid surface that doesn't move. And we're going to start with what I like to call the folding star. So we're going to go over our legs, let your back, neck, head relax and open up. Let the shoulder blades expand. Take a breath in. And then exhale, roll up from the bottom up, stacking your spine bone by bone. Arms come out and then go back. I'm going to show you that from the side. So we'll go down over our legs. Let our back round to everything opening up in this direction. Head hang, arms hang, and then lift up, stacking bone by bone from the bottom up. Arms come up with you. They're on the diagonal, so not like this, right? But out here, not down here. Here if you can. And extend. Again, inhale. And come up. Exhale. Do a minimum of 3. But you can do more. So let's do 5. Inhale. Out like a star. Exhaling. And last time, inhale. And exhale out like a star. Okay, so that's the first one. Next, arms across your chest like a mummy, Egyptian mummy. Keep your shoulders wide though, so try not to round them. Keep them wide to your sides, okay? And we're going to twist just your rib cage. So plant your sits bones into your chair so that your pelvis doesn't move. And then rotate your breastbone. So you're pointing, imagine if you have a light here, a flashlight, point your light to the corner, center, and other corner. Center. Inhale. Exhale. Inhale. Exhale. And you can do a minimum of 3. Inhale. Exhale. And last time, inhale. And exhale. But you can always do more, right? Okay, so lastly, let's go side to side like you're reaching for an object. Again, keep both sits bone planted into your chair, your side bending through the rib cage trunk. So you'll let yourself go like a rag doll, but I'm staying in this plane. So I'm not letting myself rotate forward. I'm not letting my head go forward. I'm keeping my gaze to the front, so my neck is getting a stretch too. But keep this sit bone planted. Don't let yourself come up so that you start to lose that connection. Now pull up from the rib cage like you're closing the ribs like an accordion being compressed. Let's go the other way. Inhale on the way out, expand those ribs. Try to breathe into those ribs on the side that's opening. Exhale, close the ribs. Let's go again, side to side. Inhale. Let that neck relax. Exhale. Notice how my head is the last part to come back up. Inhale, keeping that planted. Pull this together to exhale. Head stacks back up. One last time each side. Inhale. Exhale, lift. And last time the other way. Inhale. And exhale back up. Good, so we've gotten the spine pretty much moving in all the planes that we need to, and the head and neck too. Now let's do some things for our shoulders in shoulder blade area, right? What connects our limbs to our body, especially if we're seated for long periods of time, we tend to do things in front of us, and this all gets tight in the front and overstretched and weak at the back. So we need to strengthen at the back and open up the front. So let's start with arms out to your side. Reach wide to the sides like you're being pulled apart. Keep pulling yourself apart while you circle your arms, small circles in this range. And just breathe naturally. On this one, I would say don't do just 3, do at least 10. And then reverse your circles. And I am emphasizing the back space. So I'm emphasizing to the back, so that I'm not moving in the forefront where I'm already tight. I'm trying to challenge where I'm tight. Nice relaxed breathing. Notice how my feet are hip width apart, knees are hip width apart, feet flat underneath my knees. Next, give those muscles a break. Bend your elbows to a 90-degree angle, so a right angle here, and keep them glued to your trunk. Rotate palms up and forward. Open, close, open, close. What is this doing, you may ask? Well, we're rotating in the shoulder joint. This is external rotation. So we're rotating the humeral head, the long bone of your arm, outwards. This is a motion we tend to lose over time and can be very irritable and cause all kinds of problems like tendonitis in your shoulder. Cause frozen shoulder over time if it's left to rub and cause that tendonitis. So being able to move out like this is, good for that prevention as well as for function, because we need to be able to move in this direction to wash your hair, to do clothing, jewelry, you name it, functional things. Okay, so we're going to add on. So we've rotated out. Lift your arms up so they're level to your shoulders. Notice I rotated my palms down. Lower my elbows, palms up, and close. We open, we do like a Cleopatra, back down and close. Let me show you from the side. Open, lift, down and close. Open, lift, down and close. Do at least 3, but you can do more. This one does take some coordination, so you have to pay attention and think about what you're doing, because there's the palms up, then the palms down, palms up, palms down, palms up. Okay, enjoy that one, play with it. Cleopatra. Okay, lastly, arms out to your sides, we're going to cross and open, crisscross. I'm changing the arm that goes underneath with each repetition. Open, close. Open, close. From the side, I look like this. I really try to challenge that stretch towards the back. So we get, here opening up into the armpit, all these muscles from your big back muscle, your chest muscle, and deep in the shoulder and the bicep that attaches there, which is very commonly irritated with rotator cuff problems. Okay, and that's it. So if you did only 3 of each of those movements, or just do one of them as a movement snack. So every 30 minutes that you're sitting in one place, you can do one of these 3 to 5 times or more, and then the next 30 minutes choose another one or do the whole thing. Anyway, get just more tools in the toolbox of your arsenal of movements to keep yourself feeling and functioning better. That's all for today. See you next time. Don't forget to check out all your other videos, and eat well, play well, sleep well, move well. It all goes together. They all affect each other. And enjoy those positive social connections with people, whether it's family or friends or fur babies if you have pets, because it all matters and helps us to live a more optimal life and feel and function our best. Bye for now.